Okay, so today we're going to be talking about antenatal mental health. I'm Casey Pearson, a direct entry midwife with Moontree Midwifery, and we're just going to be talking about this one question. How does antenatal mental health affect your pregnancy and baby? So, because you are growing another human being and all that entails, they have their own nerves, they have their own organs, they have their own emotions and energy and everything else. What happens to you also happens to them. And it makes thinking about mental health just a little bit more complicated, but that's also why we need to ask these questions. So, antenatal means during pregnancy. We will not be talking about postpartum as much. Postpartum is what happens after you have your baby. And there is a lot of knowledge going around about postpartum mental health issues, and it's really out in the forefront lately. And so we're just going to be talking about how they affect your pregnancy. And the symptoms of antenatal mental health disorders vary from postpartum symptoms. So you may have the same thing, it may manifest in the same way, but they can be more severe than postpartum disorders. A article from the Washington Post a couple of years ago talked about a study that was done that showed that those that suffered from antenatal mental health issues had a more severe reaction. So they ended up getting worse faster, or they started out worse than if they had been during the postpartum time. And the symptoms of that vary, but they are very similar. So you have the anxieties and the worries and the fears, the depression, the sadness, but antenatal issues can get worse quicker, leading to paranoia and insomnia faster than postpartum ones can. And when you're growing a baby, you're supposed to be happy, you're supposed to be enjoying this time, and it's hard to do if your internal chemistry is off. So there is this scale, and in the article that the Washington Post did, they talked to a doctor that uses the scale during pregnancy and not just postpartum. So the Edinburgh scale is used in postpartum to figure out if they have depression. It's not so great at finding anxiety, but it is good at depression. And you only think of the last 7 days in your life to see how it's affecting you. Um, but this doctor recommended you add two additional questions to the Edinburgh screening, and you screen for the past 2 weeks or a month instead of the last 7 days. So the extra questions are: do you have thoughts that disturb you? And are you feeling more agitated or irritated lately? So, intrusive thoughts and agitation and irritation are both symptoms of depression and anxiety. And it's important to talk about those during pregnancy because there are things that you can do. So, the risks of this is that most times it's misdiagnosed as just hormones. Like, I can't even count how many times I've been told, oh, you're going to be fine. It's just the extra hormones making you sad, or it'll get better. Don't worry about it. And like little pat on the head, making you feel like, oh, well, I guess I am okay. But if it is an actual antenatal mental health issue, untreated, it can lead to poor nutrition, poor sleep, drinking, smoking, suicidal thoughts, like so many things that affect not only you, but your baby, which also increases the risk of preterm birth and a smaller than normal baby. So, and when we say smaller than normal baby, we're talking about someone that is full term having a baby that is way smaller than they should be. So, you're 40, 41, maybe almost 42 weeks, you should not be having a baby that is 4 or 5 pounds. You should be having a more average size baby of high 6 to low 8, if not bigger, but they should not be small. And because a lot of times it leads to poor nutrition when you have these mental health things in pregnancy, that can be part of why these babies are coming out smaller. And antenatal mental health disorders affect 10 to 15% of pregnancies, which is pretty high considering, and especially considering that it doesn't really get the knowledge and like spotlight that postpartum does when they're very similar in percentages. And this percentage is higher if you have a history of mood disorders or mood issues before, or you're low income. And we're going to talk about that a little more in a second. Babies that are born to moms that have an antenatal mental health issue have higher cortisol levels, which have been measured as higher all the way through adolescence. And so it's important to understand that this is not just normal stress and worry in pregnancy. This is an issue that needs to be dealt with for you and your baby. So these are just some of the other risk factors. Dr. Regev is a psychologist, and she has a lot of really cool information on antenatal and postpartum, so perinatal mental health. And this is from her website. So she says the risk factors include, but are not limited to. These are like some of the things that you should be out for if you are in these situations to be like just aware of, just in case something else is coming up. So unplanned pregnancy, no partner relationship is having issues, social isolation or lack of support, previous trauma, that one is a really big one, including birth trauma. So just because it's your second or third or fifth baby doesn't mean that you are exempt from any of this. History of mental illness in the family, history of mental illness in the pregnant person. So if you have a history of mental um, illness, then that's going to increase your risk. Poverty, low level of education, young maternal age. So if you are really young when you're pregnant, recent immigration, a lot of times that has to do with not having any support, being in a new country, not having that stability. So these are something that's really important to look out for. The treatment, again, Dr. Regev, I really like how she puts this. Not treating depression and anxiety during pregnancy is not an option. So, doing this is not an option. We need to be talking about treating and helping depression and anxiety during pregnancy. So there is another article that I will link to in a minute that talks about like ways that you can help your mental health. The first one is talk to somebody. Like it does not have to be your provider. They can provide resources that you may not be aware of. They may have like a therapist that they know specializes in this, or like specific resources that are in your community, things like that. So it may be worth talking to them, but even if you don't, talk to somebody. Medication is not the only answer. Exercise, herbs, meditation, like there are so many different things you can try before medication, but along the same line, medication can help. It is not a simple fix for a lot of people. You may have to try a few different meds and it can take a while. And so that is something that is used in conjunction with a lot of other lifestyle changes and things. So don't expect to start taking medication and then just completely be fine. The next one is your nutrition. So while you're depressed, it is hard to eat well. And focusing on just a few little things can make all the difference, like getting your fish oils and omega 3s, cutting caffeine, drinking water. Like, I know it's hard to drink water, and everybody seems to lately be like on this drink water train, but it's because it's so important for you. And then eating whole foods, like having actual good food into your body. So, babies of parents that got treatment during pregnancy for mood disorders had lower levels of cortisol, the stress hormone, than babies whose parents didn't get help. So, there is a study that they did. They followed these babies and these moms through pregnancy, and those that had mood disorders and those that did not, or those that did and got treatment and those that did not. And the babies that were born from the people that got treatment, even though treatment does not take it all away, the babies still had lower levels of cortisol. So it's really important. It's really important to get help, even if it's just letting someone like know what's going on. You're not alone. It's not your hormones. It's okay to ask for help.